Hi, I'm Michelle Grzoulis, and I'm president of the foundations at Rochester Regional Health, and I am happy to be joined today by Dr. Bhasvar and Dr. Bridget Wiefling, both physicians at Rochester Regional Health. And not surprisingly, our topic today is to talk about the coronavirus, and we're going to stop calling it that in a minute. But I want to thank you both for being here today. Thank you for taking
Michelle.
the time.
Thank you for having us.
Thank you for having
It's an important topic.
It is a very important topic, and we think that it's the appropriate time to start to share what we know and make sure that people are hearing from us about what's important to know about the virus. So let's jump right in. And Haloni, I want to ask you to share with our listeners, what is coronavirus?
So coronavirus is a type of virus among a family of viruses that can cause infection, mostly in animals, but there are some members of that coronavirus family that cause infections in humans. Majority of these viruses cause the typical cold and flu type symptoms. There are 3 that have really escalated that in terms of how severe they cause symptoms. The 2 that we've known about for quite some time, the SARS and the Middle Eastern, and then most recently the coronavirus novel 19, or as it's now called, COVID-19.
So that was my next question. Why are we calling it COVID-19?
Sure. So there's actually a whole taxonomy on how viruses get named.
Okay.
And in particular, this is abbreviated to reflect coronavirus disease. So corona is the the virus, the V, and then VI, and then disease, the D, and then because it was identified in 2019, it has the hyphenated 19, so coronavirus disease, COVID-19.
Okay, that's helpful, because I actually didn't understand that. So Dr. Wiefling, I want to ask you to help us understand the source of the virus.
Yeah, so interestingly, they believe that the original source of the virus came from bats in wet markets out of China, Wuhan, China. That's why it was so heavily infested there. Now it is spread person to person.
Okay.
So it is human to human contact.
Okay. And people getting bit by bats, or it's just access to their excrement?
You know, no one totally understands exactly how it crosses over from animal to human.
Okay.
But they do believe that it has something to do with the live animals in close contact with food.
Okay. So how does it spread?
Yeah, so it's a droplet spread. So it's actually in your secretion. So when you talk, when you sneeze, when you cough, the virus is in those little droplets, and they land on surfaces or land on your hands. And then when you touch the surface, or you take your hand and you touch your eyes or your mouth, and then you're actually spreading it to yourself.
Okay. And I'm going to ask probably what's a naive question for a physician, but does that virus die after it sort of dries? So on a surface, like a wet surface, you have a droplet.
Well, there is a certain amount of time by which, drying desiccation actually does kill a virus, but that's not how we typically try to disinfect or ensure precaution.
Fair enough.
And so we use disinfectants. So your standard, your bleach, your hand sanitizers are fine.
And we're going to talk at the end about advice for people, so we'll come back to that.
You got it. Mm-hmm.
So who's at most risk for the disease?
So it's
or the virus, rather.
So the virus, yeah. So the patients that are most at risk are obviously the elderly. So patients over 60, which is sometimes concerning because elderly, 60 is the new 50.
Very old. As someone who's 50.
But certainly, in the span of things, certainly those over 60, and obviously the older you are, the more risk you are. If you have other diseases that may compromise your immune system, so if you're an oncology patient and you're on immune suppressants, or you have a lung disease already that you're battling with, so if you have chronic obstructive pulmonary disease or congestive heart failure or some other conditions that make you more susceptible to this in particular virus.
Okay.
And we're lucky because pediatrics has actually done much better, but we also worry about pregnant women.
Okay.
Because they are functionally immune compromised.
Okay. So people, elderly, considered over 60, not affecting pediatrics as much as maybe we see with the flu?
Right.
Okay.
And I think, it doesn't mean that a child can't get COVID-19, but we're not seeing it as severe.
Okay. So, Haloni, I want you to talk a little bit about some of the concerns that we're hearing about in the media is traveling and people making decisions about what to do.
Yeah.
So what would you tell someone who asks you, what do I do? Do I go on vacation or not?
Yeah, certainly. So I think with travel, when it comes to planning travel that hasn't already occurred yet, I think we're encouraging everyone to go to the CDC and State Department websites to look at the most recent guidance on avoiding non-essential travel. There are countries that have already been raised to a level to say, do not travel to these areas. There are other countries. Italy, China, Iran, and South Korea. Japan is still, I believe, at a level 2.
Okay.
But the CDC website has the latest list of those areas in terms of guidance for travelers. If you're already planning travel, I think within the United States, again, using all the appropriate hand hygiene, respiratory hygiene practices, although COVID-19 is sort of the main thing in the news, the flu and all the other typical seasonal viruses are still the main concern in terms of when you're traveling.
Yeah. So I want to talk a little bit about Rochester Regional Health and what we're doing, and I'd like both of you to address this because I think you're both intimately involved with what we're doing as a health system to not only prepare internally but also prepare for the patients that we would care for. So let's just throw the topic out there, and Bridget, I'll start with you. What are we doing as a health system to prepare for COVID-19?
One of the things that we're working on is making sure that we have appropriate triage in place.
Okay.
Right? Because we don't want patients to come into the offices unnecessarily and expose others if they are potentially at risk for having the COVID-19. So for us, we're recommending to our patients that they call their office as they normally would when they don't feel well. Okay. And the nurse who is at the office will do an intake and do an assessment, and they may be given a telehealth appointment rather than be brought into the office, depending on the severity of their symptoms.
So let's pause there and just talk for a moment about what that means, because there might be some people listening who don't understand what telehealth is.
Right. So we have the ability right now through, we have a program running called Care Now, and it is virtual visits for patients that are sick and need to be seen, but don't necessarily need to or want to come into the office. And so it works very well from the standpoint of being able to create a visual video visit between the provider and the patient. It's very effective means for many of the diseases that don't necessarily need a lot of a physical exam.
Okay. So we're triaging that.
So we're triaging that. So you may be invited by your office to have a video visit rather than come into the office, or you might actually be asked to come into the office. And we are also triaging patients to specific urgent cares that are properly prepared for taking in patients that may in fact be infected with the COVID virus.
Okay. Haloni, what else are we doing?
Yeah, absolutely. As with any major global type of issue that impacts locally, our concern is always, as Bridget mentioned, to ensure that we have appropriate practices, procedures that are consistent with the most updated guidance from our local, state, and regional, as well as national leaders and experts in that area. We're very fortunate to have some of the leading experts in virology, infection prevention, epidemiology within our health system who are intimately tied to all of the various work streams that we do. So in addition to how we identify and screen patients, how we help them navigate the health system to try to minimize exposure, to try to minimize risk of not just exposure to themselves, but to our team members, and isolation practices as those are getting updated. We are prepping for all of that. And then, of course, with everything, the communication plan that really keeps all of our team members and our patients informed as they navigate care within our health system, within the community.
And so I think probably for folks who have questions, as I heard you say, Bridget, first thing is reach out to your primary care provider.
Yep.
And they'll be able to determine what sort of risk there might be and direct you accordingly. And then also just probably our website probably has information updated on it. And I know in your particular area of expertise, we probably have a lot available for people.
Yes, absolutely.
And we will be launching an info line over the next few days.
Great. Yeah. So before we wrap up, and this is just the first of, I'm sure, what will be many communications as we continue to deal with this like every other organization or healthcare provider, I think it would be helpful to just talk for a moment about common sense and how should people be thinking about what makes the most sense so we don't tip into too much fear and forget to do some real basic things that keep us healthy. So again, throwing that to both of you. Why don't we start with you, Dr. Wiefling?
Okay, sure. Yeah, I mean, it's like you should treat this very much like it's a standard flu from the standpoint of anything you would do to prevent yourself from getting the flu. is things that you would do. So you want to use good hand hygiene. So you want to wash your hands after you eat. You want to wash after you use the bathroom. You want to wash after you've been in the grocery store and you've been,
Touching
a grocery cart and other things, right? So it's good hand hygiene, right? And also stay home when you're sick, right? So
That's a big one.
and that is for the coronavirus, but that's also for any other of the viruses that are out there that, we tend to, in the healthcare field, certainly put people probably more at jeopardy sometimes because we do come to work when we're sick, and we really need to rethink that.
Okay, great. Anything you'd add, Haloni?
Yeah, absolutely. I think just as everything Bridget already mentioned, but I think it's important to keep in mind that the typical things that we see this time of year are still the typical things that we see this time of year. And things like getting your flu shot, things like making sure that if you don't have access to hand sanitizer right away, soap and water still works just as well to wash your hands. I know there's been a lot of information about hand sanitizer, and I joke that we still have soap and water available everywhere. So and then good respiratory hygiene. So covering your cough, making sure that you wash your hands. Try to minimize touching your face if you are having secretions with sneezing and coughing and things like that. So
Someone said to me yesterday, remember the ABC song, when you wash your hands.
Yes, that's right.
That's how long it should take you to wash your hands. Hot water, and that's great.
Yeah, absolutely.
And it's common sense, but I think there's so much out there, misinformation out there right now, that it's really helpful to bring people back to the reality of what we can do. Anything else that I didn't ask that either one of you think is important to share, since this is really our first opportunity to inform people?
Yeah, I think the biggest thing is try not to be afraid.
Okay.
Right? We still have our lives to live, and most people do well, even if they do end up getting infected. And so I think that's something that we all need to just make sure we're thoughtful.
Yeah, take a deep breath.
Yeah.
Yep, absolutely.
Great.
Yeah, and I think just using good hand hygiene practices, prevention for the typical things that we see, getting your flu shot, getting all of your health maintenance things, and making sure they're updated, staying hydrated, staying home when you're sick. I think those are all things, and I think in healthcare we're fortunate, like I said, especially at Rochester Regional, to have amazing amount of experts and expertise literally seconds away from any time we need them to call on them. So I feel very confident that we're able to handle it.
Deal with it.
Yeah, and it's not our first rodeo, right?
Yeah.
We've had the measles scare.
SARS,
We've done a great job there. We had SARS. We did a great job there, and certainly we had the Ebola scare.
Yeah, I remember
years
that.
back, right? So we're kind of used to doing.
We don't want to get practice at this, but it's nice to know.
Yeah, this is what we do. Right?
I had one other question that I just thought of as you were talking, Haloni. So, if someone hasn't gotten their flu shot yet this season, is it still something they should think about doing? Okay.
Yeah, absolutely.
Yes.
I think that the flu is still the most prevalent thing in our community in Monroe County and across the country. And so it's still applicable. You can still get it, and it's always good to prevent and minimize the level of illness that you may get, or prevent yourself from getting it is really important. So absolutely, if you haven't gotten it, you still can.
Great. So thank you both, first of all, for
you.
not only
Thank
for
you.
this today, but for the work you do on behalf of the patients and the health system. As a non-clinical person, I so appreciate your expertise. So Dr. Bridget Wiefling, Dr. Haloni Bhasvar, thank you very much for joining us.
Yeah, thank you for having us.
You're welcome. You're welcome. And we look forward to being back in touch soon with some additional information. Take care.